So do you want to know how the healthcare system is structured in England? Well, this video is for you because I'll go through in simple terms how funding filters down to hospitals and how the NHS structure in England is organised. So make sure you stay tuned. So the aim of this video will help professionals within the healthcare environment understand the system they're working in. And if you're ever taking any professional exams, examiners love to test your understanding of this new healthcare system structure, and especially with the new reforms and legislations that have recently happened, it's always changing. So to simplify the often confusing and changing NHS landscape, I'll cover 3 questions. And the first one is, how is the NHS organised in England? Secondly, who leads this new structure? And finally, how does funding filter down to hospitals? But the easiest way to navigate this structure is through a 3-tier level, almost like a cake, split into national, system and place levels. So if you start from the top, the Department of Health and Social Care sets out what the NHS is expected to deliver for the money it gets from the government. And this comes from general taxation. Because in the UK, the healthcare system is publicly financed. Now, NHS England and NHS Improvement have merged as one, and together they are the national body for the NHS in England, and they set the operational priorities for the health system, which provides the funding down to system level. Now, moving on to system level, which is the middle of the cake, we have integrated care systems, and they get most of their money from NHS England. But when we talk about integrated care systems, we have to note that it's actually made up of 2 parts: integrated care boards and integrated care partnerships. And integrated care boards decide how the NHS budget for their area is spent, and they develop a plan to improve people's health, deliver higher quality care and better value for the taxpayers' money. Now, integrated care boards directly replace clinical commissioning groups as of 2022, and they are the commissioners of care within the local system. And now clinical commissioning groups no longer exist as of July 2022, and they've been directly replaced by integrated care boards. On the other hand, integrated care partnerships bring the NHS together with other key local partners, and this could be the local authority, it might even be charities or housing associations, and the whole point is to focus on the wider determinants of health. Now, shifting down 1 tier to place levels, this is where the integrated care boards provide the funding at place levels. And now when we talk about place levels, this is where most of the activity takes place, as this is where the providers, and these are the hospital trusts, exist in England. And this is referring to the towns and cities where, for example, big district hospitals locate. So just to put this into perspective, if we have South Yorkshire Integrated Care System, this covers a wide geographical area. But if we zoom in at place level, we have 5 places, and these are referring to Barnsley, Doncaster, Rotherham, Sheffield and Bassetlaw. Now, to summarise this new structure, just think of it like a 3-tier cake, split at national, system and finally place level. And the whole responsibility of that NHS budget is in the hands of the integrated care boards. And this involves a minimum 3 non-executive independent roles consisting of a chair and 2 non-executive directors who will be responsible for chairing the system and how each employed member gets paid for running the ICS. Moving on, there will be 4 executive roles that focus on the day-to-day system operations, and they will consist of an ICS lead, a finance director, a nursing director and a medical director, and they are all employed under the Integrated Care Board. And at the end of this day, these group of people are your commissioners in the system, so they have to have a good governance and leadership structure about them. And finally, the partnership on the right of the diagram should include, as a minimum, 3 partner members with at least one from a NHS trust or a NHS hospital, one from a general practice provider or primary care network in the area, and finally, at least one member from the local authority. And the partnership is to ensure a representative individual voices and addresses population health needs in their area. Now, moving on, this diagram shows how funding will filter down to 4 key work streams, or providers, as integrated care boards, remember, oversee that commissioning. So they plan, purchase and monitor healthcare services for their geographical area. And they have nothing to do with the delivery and provision of healthcare. All of this falls under the providers who patients will go see, whether in a primary care setting, which is your GP or a family physician, or a hospital trust setting. Now, in each of these settings, their services are purchased and funded by integrated care boards who have that NHS budget in their hands. And in England, there is a very distinctive split between purchasers and providers of care. So in this case, integrated care boards are the purchasers of healthcare and hospitals are the providers of care. Now, thank you for watching this whistle-stop tour of how the healthcare system is organised in England. If you want to know how the other devolved nations are structured, just comment in the description below and I'll go through that in simple terms.